You're listening to WeAreSTS, a podcast from the Department of Science and Technology Studies at University College London. Hi everybody, and welcome to WeAreSTS, and welcome to UCL. I'm your host, Professor Joe Kane. This summer, we're broadcasting some student projects. Remember, I taught a new course this year on podcasting as science communication. The idea was to examine the medium through an STS lens and to explore how it might fit into everyone's skills portfolio. The course built up to final projects with students submitting an episode for this very show. Something of their own design and development. That means they did all the work, and they had to do a lot of explaining about how and why things came together the way that they did. I promised to broadcast those episodes that I found truly outstanding. Today, Isha Kapoor talks about the need to talk about the subject of suicide. Isha's just completed her BSc degree in Politics and International Relations here at UCL. She interviews one of the country's top experts in suicide risk and prevention. The focus is on myth-busting and on a few simple things that all of us can think about when this subject arrives in our lives. There's a twist in what Isha does in this episode. I think it's brilliant, and I think you're really going to enjoy what she does. For me, it makes the next 30 minutes something in the top tier. It's great listening. So for the rest of today, I'm handing the microphone over to Isha. She gets us started with a trigger warning and some great advice.
This podcast contains discussions of suicide and self-harm that may be distressing to some listeners. Please remember, help is available 24/7 via the Samaritans helpline, which is 116 123. Mental health. It's a topic that's widely discussed, yet often misunderstood. In today's world, young people in particular are facing unprecedented levels of psychological and emotional stress. As a result, teachers and other influencers of young people are increasingly confronted with new challenges related to youth mental health. In fact, currently, approximately 1 in 5 young people are estimated to experience a mental health disorder. Interestingly, post-pandemic, conversations around mental health and suicide have in fact burgeoned. While greater attention to these issues helps reduce stigma, could it also contribute to disinformation and myths about mental health? And could these myths be preventing those 1 in 5 young people from seeking help? I think so. To help us understand exactly why these myths have come into fruition, I had a conversation with my dad, who also happens to be a leading professor of psychiatry at University of Manchester. We hope you enjoy and learn from our first episode, Youth Suicide Myths, Talking to Save Lives. So Dad, I remember once when I was about 5 or 6, one of my friends asked me what my dad's job was, and I said you're a professor of psychiatry, and then they asked me what that meant, and I didn't know, so I said he's just a doctor. For people who might still be a bit confused about what it is that professors actually do, could you introduce yourself and explain your area of expertise?
Sure, Ish, and I remember that very well when you were asked what I did. So I'm a professor of psychiatry. So psychiatrists are different from psychologists because psychiatrists are medical doctors who prescribe medication as well as give talking treatments. But I'm a bit different from an ordinary psychiatrist as well. So most of my time is spent being a professor at the University of Manchester. And people say, what's that? What's a professor? What being a professor involves is doing a bit of teaching when I can. So that's always a really rewarding part of my job. But most of the time we spend researching. And my specialist area of research is actually self-harm, so when people hurt themselves, but also suicide. So we research the causes, prevention and treatment of suicidal behaviour.
So obviously you're a mental health expert, but you don't really talk like one when you explain things to people. How do you strike a balance between being understandable and staying true to your academic background? And do you actually enjoy sometimes sounding like a professor?
That's a brilliant question. And a lot of academics you'll meet, Ish, and you'll know some. I think sometimes unnecessarily use academic language and hide behind jargon. I think one of the things we've prided ourselves on in our unit right from the beginning is making our research accessible. So I know we've had chats about this sometimes where you've thought my writing style, my presentation style is almost like too simple. But for me, that's a key part of, first of all, like the knowledge transfer. So if you've got a bit of research, it's no good if it just sits in a journal. You've got to get it out there. So I try and make it as simple and as accessible as possible. But it is possible that sometimes people then think, I've not got a whole lot about me. And in fact, that did happen once in a journal. So on one particular occasion, from a prestigious American journal, they said, who on earth has written this? Because it was written in such colloquial and simple language. But anyone listening, for academic writing, the simpler the better, as long as you can get your concepts across.
So whilst doing my research, I've realised that there's lots of misunderstandings and kind of myths about mental health. And one particular myth I've read about is the idea that talking about suicide might lead to more suicides, or talking about suicide is somehow bad. Is that true, or is it a misunderstanding? And could you kind of explain that in regards to the Werther effect, which is something I was reading about too?
Yeah, it's such an interesting question, that Ish. And I think hiding suicide or not talking about suicide is not a good thing. It leads to stigma. It leads to people hiding how they're really feeling. It leads to people being perhaps kind of reluctant to help someone who they see is in distress, who, might have ideas of hurting themselves or even wanting to end their own lives. That kind of thinking, that kind of stigmatizing thinking, I think, impairs that kind of help seeking. In general, talking about suicide doesn't lead to suicide being more likely. But you've raised a really interesting point, and it's I'll correct your pronunciation, Isha. It's German. It's Werther effect, and that's actually from a 16th century German novelist. It's Goethe, a very famous novelist, and he published a book, The Sorrows of Young Werther, where he told of a young man wronged in love, who sadly then took his own life. And what that led to was a series of, we'd call them imitative suicide deaths across Europe. And the book was actually banned. So, if we're going to talk about suicide, it must be destigmatized, but we need to talk about suicide in the right way. And in particular, the media have a key role to play.
Yeah, I think the media does play an interesting role, because I remember at the start of the pandemic, there was a lot of talk about how suicide rates might skyrocket. And I remember you saying that there was no evidence to suggest anything of the sort. So why do you think these kinds of myths persist even when there's a wealth of evidence to debunk them?
You're absolutely right. At the beginning of the pandemic, there was always this thing about, the effects on mental health are going to be terrible and there's going to be rises in suicide rate. And of course, one of the things we now know is the pandemic affected different people in different ways. Overall, suicide rates actually fell. And some of us actually said that near the beginning, that was a possibility because of this effect of kind of social cohesion. So, we know during world wars, during periods of societal stress, people kind of pulled together. And there was certainly evidence for that, well, early on in the pandemic at least. The other bit of your question is, why do myths kind of occur and how do they get propagated? And I think that's a newer phenomenon. I mean, some people might talk about our modern means of communication. I'd call them modern. You wouldn't call them anything. But things like social media. We can't have a conversation about mental health without talking about social media. On social media, everyone's opinion is almost kind of equal.
Yeah.
So I might say, well, the research evidence was there was no rise in suicide during the pandemic, but someone else could kind of pipe up that actually, in their experience, it was totally different. And it can lead to myths being propagated as fact.
Whilst this initial conversation provided insight into the myths of mental health more generally, there are a wealth of specific misconceptions that merit attention. One topic in particular is men's mental health and the reasons behind the higher suicide rates amongst men compared to women. Understanding these statistics is central to helping young men feel comfortable talking about suicide. Given this, we sought to unpick whether these statistics could be linked to greater societal pressures placed on young men, or other significant life challenges they may face, such as higher rates of substance abuse. So something I think is quite relevant this month is Movember. Have you heard of Movember?
I am familiar with Movember, Isha, and I know, listeners to your podcast can't see us. So unfortunately, I am not sporting a luxuriant moustache, but I'm familiar with it, and it's a great initiative and supports men's mental health, which is really important.
Mm-hmm. So could you maybe talk about specific misconceptions about men's mental health?
Yeah, I mean, the big one, let's be totally open about this. There are differences about men and women's mental health. There's differences in outcomes, there's differences in treatment, there's differences in help seeking. But one of the big things is that men don't seek help. That's one of the big things we've talked about in mental health. And I think there is certainly evidence that men's help-seeking behaviour is different. From me and Mum, don't you, Ish, that if I get ill and Mum gets ill, I'm much less likely to go to the doctor, probably even when I should. Yeah, absolutely. So there's definitely some differences in help-seeking, but I think that actually a myth that we were able to kind of unpick in one of our studies a couple of years ago, that men don't seek help. What we found was in the group of men who were sadly at highest risk of suicide, did they seek help or didn't they? We found that 90% of them had sought help in some way prior to suicide. So I think it is partly about encouraging men to seek help. I think that is, but this is a myth that men don't talk in a way. Yeah. And I think the challenge is for men's mental health, having interventions, having treatments that are fit for purpose. Okay, so that work for men and that reach men. There's been some really interesting work going out, reaching the men where men go, through football, through sport. There are a couple of brilliant charities that promote mental health through sport. And Movember, that you've already mentioned, raises money and resource as well.
So if men are seeking help, then what's the reason for high suicide rates amongst men then?
So I think partly it may still be to do with help seeking and how effective they find their help seeking. But there's many other theories for, the disparity in mental health, in particular the disparities in suicide rates. One of the explanations is to do with risk factors, things that are associated. So we know that many of the things that make suicide more likely occur more frequently in men. So things like alcohol and drug misuse increase the risk of suicide, but they're also more common in men. Things like economic hardship. There's some evidence that when people are affected by unemployment, that can sometimes hit men harder than other groups. So partly it's to do with clustering of risk factors, and partly it's to do with, it's a very uncomfortable topic, but it's partly to do with, how men sometimes hurt themselves. And one of the things we know is when men do hurt themselves, when men do have thoughts of self-harm or even suicide, they tend to pick more dangerous methods, which are more likely, very, very sadly, to result in death.
Although this conversation uncovered more about the risk factors leading to higher suicide rates in men, another topic worth exploring is the public perception of people with mental health issues and how it may be shaped by myths or misinformation. There are many dangerous misconceptions that can prevent teens from seeking help or receiving support. Misconceptions like the belief that only mentally ill people experience suicidal thoughts, or that those struggling are just seeking attention. These misconceptions, especially in environments like schools where educators play a crucial role, can have serious consequences if left unchallenged. So one common misconception is the idea that you can't necessarily tell if people are suicidal because there's not always warning signs. I think this is really relevant, especially to teachers who are often tasked with being on the lookout for suicidal behaviours amongst teens and other young people. Would you then say it's true that you can't necessarily tell if people are suicidal?
Obviously, teachers and other professionals can, only respond to what's in front of them, can only respond to, what they know. And I think, it's the general signs of kids being, under stress or not coping that they're very familiar and they might look for. Obviously, if it's more serious than that, if, people are expressing ideas of wanting to hurt themselves or thoughts of wanting to hurt themselves, teachers need to intervene. I mean, sometimes, unfortunately, these things do happen without warning. But when the warning signs are there, I think teachers and all professionals have a responsibility to act.
I think another common misconception is the idea that rising mental health issues, especially amongst young people, can just be attributed to them seeking attention. Can you explain why this isn't true?
Yeah, I think, self-harm is sometimes described in that way as well. There are always kind of multiple causes and often serious underlying issues that need to be addressed. And it's really kind of quite dismissive and unhelpful when it's just dismissed as attention-seeking. When I talk to young people, when I talk to patients of all ages, but they say there's better ways of, if I want attention, I can seek attention in other ways. This is a sign of distress. It's, something that professionals, teachers, peers need to kind of intervene with, really.
So what you're saying is young people who are expressing these suicidal ideas or thoughts of self-harm really do deserve an intervention. They deserve being taken seriously.
Absolutely. And when we did our national guidelines on self-harm, that was almost our number one recommendation, that people who, have hurt themselves, who have had an episode of self-harm, deserve the same care as everyone else.
One thing I came across, which I didn't really understand when I was trying to do some research, was the idea that if someone's suicidal, it doesn't mean they want to die. Could you explain why that's not always the case?
The whole notion of trying to unpick people's motivations when they're distressed it's actually really, really difficult. So a lot of my colleagues in the States, brilliant colleagues, will say, no, we've got to separate out into people who are hurting themselves or having thoughts of hurting themselves, but don't actually want to die. And then we want to kind of, if you like, siphon off those people who do want to die, and we intervene with those people differently. Mm-hmm. Now, when we're talking about that, it sounds perfectly logical, doesn't it? You've got people who are, attempting suicide and people who are indulging in non-suicidal self-injury. The problem is that people's intent changes. Mm-hmm. And when people are in distress, sometimes you can't unpick those motivations. Okay, so you can't unpick. So one of the things we tend to do is talk about self-harm as one thing. So, and within that self-harm, it's a broad spectrum of behaviour, and some people will have intent to die, some people will have much less intent to die, but it's a recognition that there's some kind of continuum. And you're absolutely right. Some people who even hurt themselves in very serious ways, when you try and unpick their levels of, intent, their levels of, thoughts of wanting to die, that might not be coming to the fore. Whereas other people, they've hurt themselves in not very medically serious ways, and yet, have big thoughts of really wanting to die. So it's a continuum, and that really needs unpicking by skilled clinicians.
There's also this idea that only people with diagnosed mental health conditions consider suicide, but I know that's not completely true, is it? Could you explain a little bit about how other factors can play into this? Yeah,
I'm a bit unusual as a psychiatrist, Isha, because I don't really like psychiatric diagnosis. So sometimes, they're in danger of being kind of almost diagnostic labels rather than reflecting reality. Do I believe that everyone that dies by suicide has a formal mental illness? Well, the older studies, the original studies, did indeed suggest about 90% of people who died by suicide had what we might label a mental illness or a mental disorder. I'd prefer to conceptualise it a bit differently. I prefer to conceptualise it in terms of mental distress, often intolerable turmoil that sometimes you might be able to helpfully label as a mental illness or not. But the really important thing to note about that, suicide is really complex. I think that's a really important message. So they're not just mental illness factors that are important, but all sorts of other things. Things like societal factors. That's a big one. Social factors and mental illness, social factors and suicide. Everyone who's listening to this will be familiar, with the cost of living crisis, with recent economic pressures. Things like unemployment, we know increase suicide risk. It increases, the adversity and burden in people's lives, and that translates into poorer mental health outcomes and sadly increased suicide rates. So social factors are really important. And the other important thing is it varies across the lifespan. So, for older people, physical illness, bereavement, they're factors that increase risk. For younger people, the risk factors are very different. Self-harm's a really important thing in younger people. And the other things that I think have got rightly quite a lot of publicity recently are things like, bad things happening in childhood. Bad things happening in childhood can scar people, can make mental illness, can make distress more likely in later life. But also current things happening. So, the big thing that people have heard about in the news recently is domestic violence. And domestic violence as a factor in mental illness and suicide, I think, has been under-researched. I think we need to do better there.
Something that I've just picked up on throughout this conversation is you've been saying died by suicide instead of committing suicide. Is that a conscious choice that you've made?
Absolutely. And language really matters. So I'm often asked, committed suicide, why don't you like that? And, what do you commit? Often people use commit in a kind of vernacular to refer to crimes.
Yeah.
And that's interesting because if you look at the history of suicide, prior to 1961, so that is a little bit before even I was born in, but prior to 1961, suicide was a criminal offence in this country. It was an offence of attempted self-murder. I mean, it almost defies belief. And that's where the kind of committed comes from. And that's why, for me, committed is quite stigmatising. I'll use died by suicide. Not everyone agrees. Even some, service users, even some patients will use, the vernacular. But it is a very deliberate decision. That's right.
Having learned more about the language and perception of youth mental health, I wanted to examine the impact of a more recent development on mental health and suicide. Social media has become a cornerstone of young people's lives, with studies showing that the majority of teens spend several hours a day scrolling, sharing, and engaging online. While these platforms offer connection and creativity, they also serve as a constant stream of information, some helpful, but much of it overwhelming or misleading. Adjacent to burgeoning social media usage, mental illnesses are also on the rise in young people. It's crucial then to understand how young people can navigate social media and its challenges, and how easy it is to do so in our technological era. Obviously, early in this conversation, something we touched on was the role of social media. And I personally think it can be quite a double-edged sword in that it can spread awareness, but also very much can spread disinformation. Have you seen any examples of this? And what advice would you give to listeners on navigating mental health information on platforms such as X or Instagram?
I think this is something that comes up again and again, and it's so interesting. It's not a simple story. And, everyone will be familiar with this notion that social media is terrible for our health. There have been, some really tragic and horrible, well-publicised cases of people's mental health being worsened by exposure to social media. On the other hand, though, all of us know that some of the communities that social media enables can be helpful. Those communities can actually be positive. So I think it's absolutely right that there's two sides to this story. I think it's partly the role of educators to help people navigate social media. It's partly a responsibility of young people themselves, and actually young people are smart. I remember you telling me how most of the time, as a young person, you can navigate between helpful and unhelpful sources of information. And of course, as we've talked about previously, maybe that doesn't apply to young people who are kind of vulnerable. So we definitely need to be careful. But young people are savvy, and we need to encourage that and foster those skills. So you've got, the responsibility of educators, the responsibility of people themselves, the responsibility, I think, of parents when people are getting used to dealing with social media, but also the responsibility of governments. And this isn't very popular, but I think legislation has a role to play as well. And we have something called the Online Safety Act now. It's a world-leading kind of safety act, in my opinion, and it's about legislating to make online spaces safer.
It's really interesting that you've brought up parenting there, because it actually ties into my next question, which was how being a parent has affected your outlook on youth mental health, because obviously you're a parent as well as an educator.
Yeah, so youth mental health, self-harm and suicide in young people, it's a really, really important issue. The thing about when you're a parent is it also, I think, becomes personal. You hear about young people who are struggling. You hear about how often those young people have been helped, and that's really heartening. And also at times, if you look at the discourse in the media, it can be a bit worrying as a parent. So, yeah, it really has affected my outlook. But my one message to parents out there is that even with things like self-harm, they do resolve, help is available, and outcomes can really be very good.
So obviously this isn't a clinical podcast, but something that was really important to me was incorporating some kind of general message, because there might be people struggling with their mental health who might be listening to this. So could you maybe just tell us a little bit about the general public health messages around suicide and mental health?
Yeah, I think that's really important. And as you say, Ish, this isn't kind of clinical advice, but I mean, the most important thing is people kind of reaching out and reaching out for help. I think, one of the most distressing things is when people feel alone, they feel like there's no way out. There's always a kind of solution. There's always another way. Suicide's never really the answer. So reaching out, seeking help is important, and trying to kind of maintain this sense of hope. And that's an important message for loved ones, for teachers, for lecturers, for parents as well. Being mindful of the mental health of others as well. So keeping an eye on people and looking out for each other, as well as, of course, each of us looking after our own mental health. I think that's really important.
I think that's all we've got time for today. So thank you so much, Dad, for sharing your expertise and helping us bust these myths. I think I finally have an answer for anyone who asks me what my dad does now after 20 years. To anyone listening, if you or someone you know is struggling, please remember that help is out there and talking about it can make all the difference. So thanks so much, Dad.
Thanks, Ish. It's been a real pleasure talking to you.
As our conversation came to a close, one thing stood out clearly: the power of open conversations. Sitting down with my dad to explore these topics wasn't just an opportunity for me to learn, it also underscored how vital it is for young people to be given the space to talk openly about mental health. It showed me that when we're trusted with these conversations, we're not afraid to ask questions and learn how to support ourselves and others. Too often, young people are dismissed as being too naive or unprepared to handle tough topics like suicide or mental illness. But that couldn't be further from the truth. By having these open dialogues, we not only break the stigma, but also equip ourselves with the knowledge and compassion needed to make a difference. Mental health should never be a taboo subject. When we engage in these conversations, we normalise them, and in doing so, we create an environment where seeking help and supporting one another feels natural. I hope this podcast inspires you to start similar conversations in your own life, because when we listen, share and learn together, we pave the way for not only better understanding of mental health, but also meaningful change.
Oh, that was brilliant. And brilliant on a couple of levels. That word stigma circles around and around in this interview. Whatever we do, folks, we have got to remove stigmatization so people can take that one step forward they need to do to get whatever help they need. We're all in this together, folks, so please think about the words we use, think about the stories we tell, and think about those moments when just a little bit of support can make all the difference. If you know someone interested in the things we do here in STS, just ask them to get in touch. Maybe it's to explore policies in mental health. Maybe it's to ask about social media and that shocking lack of responsibility. Or maybe, just maybe, they're interested in the history of medicine and health, either in the clinic or in the outside world. These all fit under the umbrella of Science and Technology Studies, or STS. We're a thriving community here at UCL, and there's always room for more. Super big thanks to Isha for letting us use the episode. That was really clever bringing your dad into the episode. It's a great example of making the most of the resources that are close at hand. And thanks too to Professor Kapoor. Man, you made that sound so easy. Music today included Rollin' at 5 by Kevin MacLeod. It's available online at incompetech.com. Other music is listed in the show notes. WeAreSTS is a production of the Department of Science and Technology Studies at University College London. If you want to find out more about the show, listen to past episodes, or just give us some feedback, visit us online. Here's the address. It's ucl.ac.uk/STS/podcast. That's it for today. Thanks for listening. We'll have another episode ready soon. Until then, just remember, folks, there's knowledge to be found just about everywhere. And together, we are STS. Bye now. You've been listening to We Are STS, a podcast from the Department of Science and Technology Studies at University College London. Subscribe to the show and join us online. The address, ucl.ac.uk/STS/podcast.